The nurse procedure failed, resulting in an extremely severe deformity. How should this reoperation be done? The patient was a 13-year-old boy with primary disease of pectus ectopitum malum. 8 years before coming to our hospital, he underwent nurse procedure at the local hospital, and the operation failed. The postoperative deformity worsened, turning from a simple depression to a complex deformity. He has a localized reed-like bulge in the right chest wall and a depression on the left. The steel bar was removed 2 years after surgery, after which the deformity progressively worsened. The patient had been experiencing discomfort after surgery. After the bar was removed, the patient often felt dyspnea, which worsened with activity. The patient went to several hospitals for help, but the deformity was too complex to be treated, and the patient was finally admitted to our hospital for surgery. On admission, he was found to have a severe deformity of the anterior chest wall with a reed-like bulge on the right side, a depression in other parts, and a large point in the middle of the anterior chest wall. The chest wall was severe distorted as a whole. Heartbeat might be seen. Imaging examination showed a severe deformity of the anterior chest wall. The right side was protruding with an acute angle deformity. The deformity of the patient is extremely severe, and the surgery is challenging. The challenge came from two aspects. One is the risk of the surgery, and another is the difficulty of the operation. Because it is reoperation, there is severe adhesion between the heart and the anterior chest wall, which pose a risk to the operation. Due to the complex deformity of the anterior chest wall, the bone is hard, and there is acute angle deformities, which makes the operation extremely difficult. In order to complete the surgery smoothly, we made thorough preparation before operation. The surgery is performed under general anesthesia. The first important work we did was pre-shaping. The target is a reed-like bulge. The purpose of this technique is to soften the chest wall and lay a solid foundation for the thorough correction. The next surgery we did was one procedure and one procedure. These two procedures directly correct the deformity and achieved certified results. Pectus ectopitum is the most common chest wall deformity, and the nurse procedure has been consistently recognized as the most effective treatment. But the lesson of this patient failed surgery is the failure to master the technique of this surgery can lead to serious failures with catastrophic consequences for the patient. For patients who have failed the nurse procedure, this procedure cannot be used as an ideal option due to the fact that it's a reoperation, considering the influence of various unfavorable facts. The surgical methods we recommend are one procedure and one procedure. These two surgical methods are safer and safer to operate, and they can overcome various risk factors and difficulties in surgery, so they are a good choice. If you are interested, you can try it. I'm Dr. Wang from China.